Good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Paul Thomas and Bill Kearney in the studio today. Welcome, Bill, and how are we?
We're doing great. I was going to do a little quiz for you, a medical quiz this morning. And
we haven't had one of those in a while.
I know, it was 20 questions, and I didn't do so well on the quiz myself, so I didn't print it out and bring it in, but it started easy, and then it got harder, so...
Was it multiple choice or?
Yes, it was multiple choice, but some of the words I couldn't even pronounce. So I thought this isn't going to work on the air. So we're going to be talking more about your health and some of the new things that we've talked about. But we're going to talk about something we talked about several times and we've kind of forgotten, and that's saving money on your medication. And I subscribe to Consumers Union, and one of the things that it always tells you what the chain drugstores are doing. And the article on saving money on your medication used Costco and Kmart and Rite Aid and Sam's Club and Walgreens and Walmart. And what I noticed were some of the discount programs that they offer, ours were just as good, if not better. And any membership that you get in with us is a one-time charge for less than $10, and you're in it for the rest of the time. So we have a $4.99 program for generics that are on the Good Neighbor Pharmacy formula for 30 pills, and a $10.99 for a 3-month supply if it's on the formulary. And so something like lisinopril or hydrochlorothiazide or some of those will be $4.99 for a month's supply. Or we're finding people now that have been told by Safeway because of the Retail Clerks Union they can't go to them, they can't come to us if they are within 10 miles of a Safeway store. And so we're having an issue trying to get a lot of the ex-Safeway employees and current Safeway employees that used to come to us to get their medications. But yesterday we had a couple that we ran through on the discount card, and it was less than their copay would have been with Safeway. So Kmart has a $5 or $10 for a 30-day supply, and $10 or $30 for a 90-day supply. Costco varies significantly. You may get up to 70% off the price charged by other pharmacies, but they're determined at the time of purchase, and you won't know until you get your prescription filled what it's going to be. Rite Aid is $9.99 for a 30-day supply and $15.99 for a 90-day supply, and we are much better than that. Sam's Club, which we don't have. Walgreens is $5, $10, or $15 for a 30-day supply, and $10, $20, or $30 for a 90-day supply, so we're cheaper than they are. And Walmart's about $4 for a 30-day and $10 for a 90, which is similar to what we are. But I just want you to know that many times when you come in and your prescription is not covered by your insurance, even though it doesn't count against your deductible, we can run it through our Good Neighbor Pharmacy plan. And just ask the girls when you come in. We do probably more Good Neighbor Pharmacy patients on prescriptions than any of our Good Neighbor pharmacies that are around us. So it's something that's been there for a long period of time. You don't hear us advertising it, which we should do more of. But always ask about the Good Neighbor Pharmacy plan. Good Neighbor Pharmacy is also the people that you can get your kids up to 12 years old free vitamins every month by coming in and just signing for them, and doesn't cost you anything. So saving money on your medication isn't necessarily always going to a chain pharmacy and thinking that it's going to cost you less, because in many cases some of the chains are some of the highest that there is. So we just want to make you aware that even though we're independent, we still offer those kind of questions or those kind of prices. We've talked to you recently about a new thinking about blood pressure, and also about a new thinking about high cholesterol. And for many doctors and consumers, they got very concerned after 2015 when the release of results from a large clinical trial said that people with high blood pressure aim for a systolic or an upper number of less than 120. That's well below what's recommended by many expert groups. And only at people at a high risk for cardiovascular disease, meaning a stroke or a heart attack, didn't necessarily need to, those are the only people that necessarily needed to lower their diastolic pressure below 120 or their systolic pressure. And getting blood pressure below 120 usually required a high dose of medication or the use of multiple meds. So that would increase the likelihood of side effects, which a lot of people, when they go on blood pressure pills, because blood pressure hypertension is called a silent killer, they don't realize that they have a reason to take medication. And then they go to take a medication and they get side effects. And so they take it for 2 or 3 days and they realize that they feel worse, and so they don't continue to take the medication. And there needs to be a new clarity on advice from the health organizations. If you're 60 or older and have no other cardiovascular risks, meaning you haven't had a heart attack or a stroke, diabetes, high cholesterol, smoking, those guidelines recommending maintaining a systolic pressure below 150. Not 120, but 150. Now, if you're at risk, then it's 120, but that's appropriate for most people in the above group. There were several studies suggesting that having that aggressive treatment to get your systolic blood pressure below 140, who are over the age of 60, that it didn't extend their life or reduce the number of heart attacks. It did, however, possibly lower their risk of strokes. So if you're over the age of 60, they recommend and not a high risk for high blood pressure. The goal is to have your systolic at 150. If you're at risk, it should be under 140. But they leave the guidelines up to the people and their doctors to undermine or to determine what blood pressure levels really work for them. I have a patient that just recently hit the century mark, and his blood pressure is over 200 on the lower end and over 100 on the upper end, and he's very healthy. Lots of times it just calls for lifestyle changes, and we've talked about this before. And I bring this up every time, diet and exercise, but people don't want to be patient about what they have to do in order to maintain that lower blood pressure and keep it more flexible. And many times it's just a matter of eating the right thing and having the right kind of exercise. I just read an article the other day where people that were sedentary, that sat for more than 30 minutes, if they got up and stood up, they didn't even have to exercise, stood up 10 minutes out of that 30, they would lower their risk of having a cardiac event substantially. So if in fact all this doesn't work and you need to go into surgery, and whether or not it's an ankle, a femur, shoulder, heart bypass, or what, there's several questions that you need to ask about the surgery and what you need to find out for the best possible care before going under the knife and during and after a procedure. And it becomes you being proactive, and that's what I've said many times on this radio show, that you need to be the one that's more responsible for your health. So when your doctor recommends that you have an elective procedure, it's important to gather as much information as you can. Now, with data available on the internet from substantial, reliable sources on saying what the rating is of a physician, there's a few questions that you need to ask. And again, it's difficult to be a patient in this situation, but we're going to have to learn. So if there's a surgeon that's going to operate on you, you need to know if they've had significant experience with the procedure you're going to have. The more often a surgeon has done these surgical procedures, the lower the risk of complications or even death for the patient. So, and there isn't any magic number. When it comes up to a hip or knee replacement, for example, you want a surgeon who's done at least 50 in the previous year with a complication rate of around 3% or less. And a study published in 2017 looked at laparoscopic hysterectomies, found that there may be a learning curve for the first 100 procedures. So what I'm saying here is you need to do a little bit of research. And you don't necessarily have to confront the surgeon in order to find out the answers to those. Another thing is, how safe is your hospital? Multiple hospitals might have all kinds of different conditions. We know already that one of the problems with hospitals is the amount of bacteria that's present, and many people get MRSA, methyl-resistant Staph aureus, from being in a hospital because there are so many bacteria around the hospital to start with. Your surgeon may not be able to give you that kind of information, so you might have to find out on Consumer Reports and how it rates your hospital or another source to rate their rate of infection. And this is where we really get caught up, is the tests that we have to do. We have x-rays and blood tests and stress tests, and sometimes the pre-op that you have before you go into surgery is more extensive than the surgery itself. So people with certain medical conditions need to have preoperative tests to make sure they're in good enough physical condition for surgery, and we don't question that. But the practice has been broadly adapted for healthy patients too, and many times that's not necessary. You probably don't need a chest x-ray unless you're a smoker, or you have symptoms of a heart or lung disease, or you're having major surgery in the chest or the abdomen. Blood tests certainly aren't needed if you're undergoing an elective procedure that's considered to be low risk, such as cataract surgery. Many times they will tell you they want to get a blood test to find out what your hemoglobin is or what your CBC is, complete blood count. And having a stress test may also be unnecessary because many of the surgeries non-related to cardiology the risk is very low. I can remember years and years ago where we had a physician in the area that required everybody that went in for any kind of a procedure to have a pulmonary function test. They called it a PFT. And many times the physician never got back to the patient to tell them what the results of the PFT was. It was just a revenue source for the hospital. So the other thing that happens is when you start getting billed for all these things, and I've had numerous surgeries, is you'll find out maybe the anesthesiologist wasn't on your health care plan. You don't know who's taking care of you. You didn't ask. You probably already know it's important to make care that your primary surgeon accepts your health insurance, but what about the other people that are involved? There's often providers you have no role in selecting, such as an assistant surgeon, an anesthesiologist, a pathologist, a person to review your biopsy, radiologists, out-of-network consulting specialties. You will find now that many physicians are quitting their practice and they're going to work for a hospital. Is their insurance covered on your major medical insurance or not? And these are life-changing questions that you can ask me, because there's often nothing you can do. And although more than 20 states are currently working towards having already enacted protective measures for you, I can guarantee you we're not the first place on the totem pole of who to take care of for health care. So I think the best thing to do is ask your surgeon to make sure those involved in your care are in your network, so he or she can take into consideration when selecting a surgical team. Now, they may not want to do that, but they're the one that's telling you you have to have the surgery. As many surgeries as I've had, I would say in a good 80% of the cases, the surgeon would say to me, this is up to you to determine when you want me to operate. I'm telling you the condition can get worse. I don't know whether it seems to you that it's time not yet, and if you can't, I mean, I'm waiting for my condition to get worse in my knee, and my surgeon says, you know, you have a lateral meniscus tear, you have a plate that needs to be removed, and it's only going to get more painful. My objection is I don't really want to go under anesthesia again. It's been so many times that the recouping from the anesthesia for me is more difficult than recouping from the surgery. I've been informed that they can do another procedure, a spinal procedure, that will not go into my central nervous system, and I won't need to worry about the anesthesia. I'm a kind of a stubborn Irishman in a way, and I don't normally want to be talked into something I don't feel I need. However, if it gets to the point that my ability to ambulate and to walk and to perform duties, that the pain is the biggest deterrent, then I'm going to have to look at it differently. You, as an individual with your health care, need to do the same thing. And when you were looking at these physicians that have changed their offices and they're working for another medical group now, your office visit may change. When your doctor leaves private practice for a hospital-owned one, you may find that he or she has a new office staff and there's new rules about canceling appointments and doing things. Your costs may increase because several factors might affect what you're asked to pay. For example, when doctors join a hospital-owned practice, they'll begin accepting some new insurance plan and dropping others. So you need to ask the billing department, just because you're following your physician, is that hospital going to take the same insurance you had with that physician before? Does the practice still participate in your plan? Otherwise, you'd be stuck with an out-of-network bill. If he still accepts or she still accepts your insurance, your co-insurance, or the percentage that you may pay out of your pocket may go up. So that's because your doctor may start charging his new employers prices for tests and other services. And tests are one of the things we just talked about a few minutes ago, but those are really costs that can vary substantially from one part of the county to the other part of the county, or one part of the Bay Area to another part of the Bay Area, and you may get a 50% reduction in price by choosing one of the two that you just didn't know about before. By joining a larger group of healthcare providers, your physician is likely to provide you with access to a broader network of on-call and consulting doctors, but that is not necessarily the case, but not always. Just before having a colonoscopy the other day was administered, this patient to check with his doctor to see if the outpatient procedure suite would be performing the test. And he found out to discover that a doctor in training was scheduled to do the test, and that his doctor would only be supervising. So the new medical center is a teaching facility, and it was they were teaching people how to do this procedure, and you were the part that was uncertain. So most patients' Bill of Rights gives you the right to know the names, positions, and functions of all the hospital staff involved. You need to know that. I had an occasion when I first was having a colonoscopy for colon cancer, where they missed the colon cancer, and I went to my family practitioner and said, I need to go to somebody that's an expert in this field. And I'm not blaming it on the surgeon before, but when you go to a specialist that's all they do, the chances of that being more effective is highly enhanced. And in this case, they found the cancer. So when we talk about these things, we're asking you to put this responsibility on your shoulders, and most of us, and especially as we age, and we don't want to put ourselves at risk, we're afraid to ask some of these questions. Some of the younger physicians are used to these questions, and they're taught that in medical school. Some of our physicians that have been around for a long time are well informed about it, and some of them are reluctant to help you out with that information. So you need to be proactive when you're seeking medical care. Lots of people are having this virus that goes around that affects the breathing, the coughing, the congestion, the ears, and most every day somebody comes in with questions about removing earwax. It's really better to leave the earwax alone unless it's causing problems, such as a hearing loss. As you know, I swim every day. My ears get full of water. I should put earplugs in them so that doesn't happen. I think I'm going to start doing that. I don't get a hearing loss from it, but I can feel the fluid in my ear. And over-cleaning can lead to irritation and infection and even wax impaction. You wonder how that can happen. But if you do what most people do, they will use a Q-tip and put in their ear. And instead of cleaning that out, they push the wax further in. If an earwax remover is desired, then Debrox, or a generic form of Debrox, which is hydrogen peroxide, and olive or sweet oil, or even water. There's no good evidence that one works better than the other. The difference in having Debrox is it has the hydrogen peroxide, which is it's H2O2, and it has bubbles in it. And so it sits in your ear and kind of infiltrates that wax and helps get it out. And if you have an ear syringe, that makes it even better. In most cases, you place 5 to 10 drops in the ear canal, leave it in the ear for about 15 minutes. If needed, you can use a soft rubber bulb with warm water to gently remove the remaining wax. You've heard this before, and I'm a big person that doesn't listen to this, although I should, and it is don't put anything smaller than your elbow in your ear. So that eliminates Q-tips and about anything else. So we want to discourage ear candling, which we used to sell ear candles, and people said they were very effective. Too many people got burned. There's no evidence that those draw out wax, and it can cause burning. So the most important thing about using something for your ears is, if you can, leave it alone, and unless it's causing a problem, then it eventually will go away. We're going to take a break. When we come back, we're going to talk about why fewer Americans are trying to lose weight. Have you recently been discharged from the hospital or special care facility and need help in getting around your house? Hi, my name is Bill Kearney, owner of Northlake Medical Pharmacies in Lakeport. My wife Dana and I own Northlake Medical Pharmacies, and in the last 7 years, we've been offering a new service in Lake County. Both of our pharmacies now sell and rent hospital and medical supplies. So if you need a walker, rollator, wheelchair, transport chair, we will rent them to you or sell them to you if you prefer. We also have lift chairs, hand, wrist, knee, leg, and back braces for your comfort if you need them. And if you're looking for a pharmacy that has great service, a $4.99 a month generic prescription plan, free delivery service to Lakeport, Upper Lake, Nice, Lucerne, and now Kelseyville, as well as rental and sales of medical supplies, then you need to come to Northlake Medical Pharmacies on Hill Road across from Sutter Lakeside Hospital and in front of the Bruno Shop Smart on Lakeport Boulevard.
A single ember that escapes from a wildfire can travel over a mile, carrying a world of trouble. It can land, ignite, and destroy your home and community. You can't control where that ember will land, only what happens before it does. With simple things like clearing areas around buildings, knowing community safe zones, and being prepared for wildfires, you could keep this from turning into this. Your home is better protected from wildfire when your whole community is prepared. Visit fireadapted.org for more tips on how to get started adapting your home and community to wildfires. A public service message brought to you by the U.S. Forest Service and the Ad Council.
Hi, I'm John Cicada. Did you know that chronic hepatitis C affects approximately 1 million Hispanic Americans? I'm visiting my father today, who's part of that statistic. Each story is different, but for at least 20 years, my father never said how sick he was getting. He stayed silent, never talked over the options with his doctor. If he had, maybe I'd be visiting him at home instead of here at the cemetery. If you still think there's strength in silence, think again. Talk to your doctor about your options and learn more at tuneintotopc.com.
There are many sounds in your day-to-day life. There are sounds that wake you up. Sounds that make you smile. Sounds that energize you. And sounds that help you relax. But there are some sounds that can alert you to danger and can help save lives. Wireless emergency alerts, now on many mobile devices, use a unique sound and vibration to bring you information about severe weather events, Amber Alerts, or other emergencies in your area. With critical information from local sources you know and trust, you can be in the know, wherever you are. For more information, visit ready.gov/alerts. Brought to you by FEMA and the Ad Council.
All right, we're back.
Okay, we're back. Having a little drink of water here. Yeah. We were, just before we went on a break, we mentioned about why fewer Americans are trying to lose weight. And I think the biggest reason is people have been acceptant of a new normal, that people are fighting weight all the time, especially diabetics, and you don't have this urgency to lose weight the way that you might have had 10 years ago. As our population ages, we start hurting more and decide that we deserve it. You know, we deserve to sit down and eat a pizza, or we deserve to have spaghetti 2 or 3 nights a week, or maybe our financial status has changed, so that's all you can afford. Is there a new normal? You know, is there research that says that overweight to obese people are it's okay, and that they will eventually work out of it? But it isn't okay, and it does affect your future, and it does affect your life, and it affects the way you physically age also. The more that you're trying to maintain the lifestyle you have and not making weight gain a prevention priority, it's hard to do, and it's painful to drop pounds. I've been dieting all my life. The only time I didn't was when I was overseas in the military and when I was playing football, because they wanted you worked out a lot, you were highly muscular. I grew up on a farm that had a lot of physical labor with it, and even though my family had a weight problem, I was the one male besides my father, and he was an alcoholic, And so it was my idea to try to stay as fit as I could. When I got out of college, and I had been wrestling and playing football, I went to Illinois and Chicago and became a pharmacist and worked all the time, usually 2 shifts. And I went from 185 to 245 pounds. When I was drafted, I weighed 245 pounds, and within 6 or 8 weeks, I was at 165 pounds. But I have fought it all the time, and with the amount of injuries I've had, I still gain weight rather easily if I don't do something physically to take care of that. So it's become a priority to me. However, I enjoy working out. I enjoy the mile swim. I enjoyed walking 4 miles in Eureka a couple of weeks ago. It gives me some comfort. A lot of people have just the opposite, and they don't feel comfortable working out. They don't feel comfortable doing exercising. And if they're a healthcare provider, which most of us now in a rural area like this go to a different physician or go to a clinic where the same person isn't seeing you all the time, and so they're not following up with you, and they say, well, you need to lose a few pounds, and then the next time you see another physician and they don't insist, but they tell you you need to lose some weight, and then say you visit 2 or 3 times a year, and that never becomes a priority. It only becomes a priority when you physically start feeling like you're not doing well, and perhaps you'd feel better if you got rid of extra weight. The other thing we have is the people that are getting gastro bypass surgery and having a surgical procedure done to lose weight. And you lose weight rather extensively, rather rapidly, almost from the very beginning. And unless you stick to the process, and females more than males gain that weight back, and you don't want to have the surgery the second time, and your insurance company probably won't pay for it the second time, you just kind of let yourself go. So making weight gain prevention a priority is something I think the most of America needs to do. We have, I mean, you look at, you dedicate yourself to watching what you eat and eating the right amounts of food and everything, and then you go home and you turn on the television, and here are all of the fast food chains advertising these 2-pound burgers and throwing everything you can on it and making it the most tasty that you can, and at least selling it to you and getting it in your system. And so it works. They start doing this, and the next thing you know, you're part of it, and you're buying into the fact that it's the kind of sandwich that you want, and you start eating those kind of calories. Well, that has negative effects on your preparations to lose weight, and so it keeps taking a bigger chunk out of your life, and then you start going on medications. And that alone should be enough to make you not want to gain weight, because the more medications you have to take, and I'm talking about blood pressure medications, and I'm talking about obese medications from keeping you obese, medications for hypertension, medications for cholesterol. All those go along with the fact that you're gaining weight. So that option becomes the same option that we've talked about. You know, what are you going to do? Are you going to do something about the weight gain, or are you going to continue taking more drugs? Now, you'd think in my business I'd say, well, you know, let's have more. Let's just take more drugs, and I'll be wealthy and not concerned about it. But as you know, if you've listened to me very long, I am concerned about it, and I do want to make sure that you're as healthy as you can be, and I don't want you to have to take more medications. Diabetes is one of the huge things. According to one of the studies that was just done from the Dutch, Type 2 diabetics have gone up for a tremendous percentage in the last 5 years. We know that. We know that people younger now are getting diabetes, and they're not doing much about it. And as that continues, we end up having poorer health. So you need to have a discussion with your health care provider. You need to talk about the kinds of treatments that are out there and what you can do. And I can guarantee you, your physician is going to tell you that you need to have some sort of guideline on what you're eating and how to avoid having these other conditions. You know, we talked a few weeks ago about does good cholesterol still matter? And a new study came out and found that bad and good cholesterol have been kind of the yin and yang of heart health for a long time. Bad cholesterol, which we know about, that's the low-density lipoprotein. That's excess cholesterol in your arteries where it can build up into plaques and increase the likelihood of heart disease and blood clots. And then to prevent heart disease, we've been told to keep the LDL levels down and HDL levels up. Recently we talked about a new drug, Repatha, that just came out. That costs $10,000 a year and can get your LDL levels down to 30. We've been told to keep the HD levels up to 45 and the LDL levels down, and it sounds pretty straightforward, but and I'm one of those people, if you listen to the show, that know that I have a low HDL, low good cholesterol. The first clue that the role of the good cholesterol was more complicated than we thought before emerged when they tried to develop medications to raise HDL levels. The drugs they tested, niacin, cholesterol transfer protein, boosted HDL in the blood, but failed to reduce cardiovascular disease risks. I used to have a physician that looked at nothing but lab values to determine how much medication you needed. And no matter what kind of a side effect that the medications had on your well-being, excuse me, he would give you more medications to get your lab values down to where they should be. Well, the whole reason they were using these drugs to increase HDL because they wanted them to reduce cardiovascular risk. It raised the HDL level to an appropriate level, but it still didn't lower the cardiovascular risk, and that surprised the doctors. Certain lifestyle changes, such as exercising more and quitting smoking, could drive HDL levels up. In my case, they didn't. Increasing the low cholesterol HDL levels artificially without behavioral changes doesn't reduce the risk at all. You know, it turns out that it's not a very, very good therapeutic target. And I felt pretty good about this because this suggests that above a certain threshold, more HDL could increase the health risks. Well, I'm not saying that I'm at that level because they would like for it to be lower than 70 for men and maybe 90 for women. 55 is about where most target levels are. But, you know, the suggestion is kind of forget the numbers because there's no evidence for benefit from any HDL-raising drug. Plus, there isn't any HDL-raising drug anymore. And it's still important to pay attention, but the main focus should be on making healthy choices. So, in other words, whether your HDL level is low or high or somewhere in the middle, the prescription for a healthy heart will still be the same. Don't smoke, drink only in moderation, exercise regularly, stay away from trans fats, which are found in fry foods and baked goods. That doesn't mean you can't have them, but just don't make it your main source of diet. And whether or not you even need a statin for your LDL lowering, if you're 40 to 75 and have diabetes or high cholesterol or blood pressure, you're advised to have them estimate what your HDL and LDL level is, and then what your cardiac risk is. And that's one of the reasons that they do the HDL, is to put that in the formula for cardiac risk. The task force that studied these statins said for a risk of 7.5 to 10%, you consider a statin. The statins are now all very low priced, unless you're into the newer statins like Crestor or something. But you can buy lovastatin, atorvastatin, pravastatin, all generically for a very low price, and you probably don't need to add anything to that in order to get your LDL level down, and just remembering that the HDL level does not go up. We talked a little bit a week or so ago about the precedents on heart disease and why there's so much focus now on irregular heartbeat and heart disease, and that's because we're losing more and more people, and more people seem to be getting AFib, which is the atrial fibrillation is an irregular heartbeat that's caused by what we would call actually faulty electrical signals in the upper chambers of the heart. The heart beats irregularly and too quickly. And a lot of people want to know if that's the case, and sometimes it increases with exercise. Should they still exercise with AFib? And it may reduce your ability to exercise. It's generally recommended that they do some exercise, but consult your physician first before getting into an exercise plan that would do that. You need to go at it slowly. Sudden drastic increases can lead to injury for people who have AFib. And we're seeing more and more people with atrial fibrillation now because of we're living longer. And it can trigger new heart symptoms or make existing symptoms worse. Instead of starting with a high intensity or long workouts, people with AFib should start with shorter, lower intensity workouts. Those include walking or riding a bike 5 to 10 minutes and build up gradually. I mentioned a couple weeks ago I was walking excuse me, in an autistic event for my grandchild, and people were running around the track at a pretty high rate of speed. I was walking. I walk about 4 miles and an hour on the treadmill, and I walked, took me 2 hours to do 4 miles on the track in Eureka. But I started slowly for a couple of reasons. I'll be 75 years old next month, and I don't want to start a hyperactive program of exercising and find out that my body can't take it. So when I swim, which is a mild exercise, that I swim for an hour, about a mile, or when I get on the treadmill, I walk instead of run. My knees aren't the best. My back isn't the best. When I'm in the water, I don't have those kind of pressures on my spine. When I walk, it doesn't hurt nearly as bad as if I try to run. So a lot of times just staying vigilant. People with AFib should remain aware of their symptoms while exercising. It can be a big lifestyle change, and a lot of people with AFib just go into a wheelchair and said, I can't do this anymore. It's too much of a risk. Well, the BEXUS exercise routine involves moderate exercise, the type that's at one level where people are able to talk during the activity. If you ever got on a treadmill and you were running and tried to make a conversation, it's very difficult to do. So you need to warm up properly, stay hydrated during your exercise, stop exercising due to pain, extreme fatigue. I pushed myself at 3 miles. I was starting to hurt, and I wanted to do an extra mile, and I did. I probably shouldn't have. But keeping the exercise moderate to light, not exercising too much. And I know you're like me. especially if you have a physical therapist that tells you, spend 5 minutes on the treadmill and you spend 15, that it's probably not the best thing to do more until you're ready to do that. Keep the weights lighter when lifting, and I do that. I use a elastic type of a rubber band to lift with, and then I keep my weight at 15 pounds to do curls and those kind of things. I don't try to hurt my back more by doing something that could not only endanger my heart but endanger my back. So there's always risks and side effects, but the benefits usually outweigh the risks. So if you get a racing heart, or you get dizzy, or you feel faint or extreme fatigue, you need to stop doing it and pay attention. The best kind of exercises for people with atrial fibrillation, and you may be on medication, and some people are, that are walking short distances, low-intensity bike rides, yoga, Pilates, or swimming. And you should avoid prolonged periods of exercise, starting off too quickly with new exercises, intense and excessive weightlifting. Instead, people with AFib should ease into these routines and make it a positive approach. You should build up the walking distances, but at all points you should be able to speak while you're during the walk. So when I was doing my stress test, of course, I was trying to talk and do the stress test at the same time. It just didn't work very well. So make sure you talk to your physician about what you're going to do for your exercising program. And if the physician doesn't address that, then you need to question them and find out why. This kind of arrhythmia is a common, affecting more people than you could imagine, over 4 million just in the United States alone. And you don't have to have a bad heart for this to happen. Other conditions or diseases can be responsible as well. Hardening of the arteries, high blood pressure, non-heart related causes are underactive or overactive thyroid, unbalanced sodium and potassium, smoking, drug use, alcohol. The treatments can vary from taking medications like beta blockers like metoprolol or propranolol or altenolol to slow down your heart rate and keep the heart rate between 60 and 100. I take altenolol. If I take my altenolol, my heart rate is in the 60s. If I don't take it, my heart rate is in the 80s. Even to the point that when I'm on the treadmill doing a stress test, they'll remove the beta blocker so my heart rate can go up so they can judge it. Also, excuse me, they can do other things with a surgical procedure called ablation that causes the radio frequency to destroy a small number of heart cells that may be performed to prevent them from triggering random heartbeats. And so they go in, excuse me, they go in electronically and kill some of those cells, destroy a number of those cells to keep that from causing an irregular heartbeat. Sometimes install a pacemaker or a defibrillator may be used to monitor the electrical system and provide an automatic correction when arrhythmia occurs. Many people that are on defibrillators are hooked up to a computer or a phone system where if something goes wrong, it jolts them back into arrhythmia again, and then they notify their physician that it's happening. So the most common type of AFib is when the atria or the arteries of the heart contract irregularly. The biggest risk associated with that is a stroke. If it lasts long enough, it may begin to form a clot in the atrium, and this clot can move out to the heart and into the brain. So that's why they put people on blood thinners. Blood thinners are anticoagulants to prevent the clot from forming and lower the risk of a stroke. Used to be we only had warfarin, which was Coumadin. And we had to take a test, a medical test, to determine the clotting time of the blood when you were on this medication. And then you would take the Coumadin or warfarin to lower the clotting time so you could not bleed out, or increase the clotting time so you would not have a stroke. So either way, you had to monitor the medication. We since have had newer medications like Eliquis and some of the others, Pradaxa, that can be antiplatelet drugs, which we keep a clot from forming as readily and prevent you from having strokes. You will see a lot of information on why that's something that we need to start controlling with other kinds of medications, where you don't have to be going to get a pro time or an INR time every time that you go to be on a medication to stop your blood from clotting. So there's also other kinds of meds. We use digitalis or digoxin sometimes to do that. We use Pacerone or amiodarone for really bad, severe arrhythmias. The problem with that drug is it can accumulate in your system. Your skin can turn purple, and it can take 3 months to get that out of your system. So although it's for an extreme form of atrial fibrillation, we don't use it as much as we used to use it because of the side effects that we found out that can happen. So the last thing I have is there was an article in Consumers about drinking water with lemon can help prevent kidney stones. As Paul has talked to us about what it's like to have kidney stones the last week or so, there is a formula for pure lemon juice per day for 32 ounces of prepared sugar-free lemonade may cut the risk of a return of 2 common types of kidney stones, calcium oxalate and calcium phosphate. It boosts levels of the citrate in your urine, which discourages the formation of stones. This lemonade therapy may be a possible alternative to traditional citrate treatments, which are often recommended to prevent kidney stones, but can cause some gastrointestinal system because this is all acid. So don't add sugar. Sweetened drinks can raise the risk of stones. So this is sipping 4 ounces of pure lemonade per day for 32 ounces of prepared sugar-free lemonade, and may cut the risk of a return of common types of kidney stones. So 4 ounces, not 32 ounces. They're making it up 32 ounces of sugar-free lemonade, and then you're taking 4 ounces a day. So one other way for you to be aware of some natural substances that can help you from curing something that can be very, very painful. A lot of people ask me about problems with their hands as they get older. I happen to have a neuropathy in my hands and wear copper gloves in order to eliminate the bad feeling at night. It's usually osteoarthritis for most people, and that's when the cartilage that cushions the end of the bones wears out, can cause pain and stiffness and even deform joints, and making tasks like tying your shoelaces, unbuttoning your shirt, tying your tie. If it lingers for more than a few days, you can determine whether it's osteoarthritis or another condition such as a repetitive stress injury is to blame. Lots of ways to treat these things with medications. I prefer to treat them with a copper glove that I just buy off the internet. It allows me to function, write, hold a pen, do things that I normally couldn't do because the pains become so highly intense at night. The next time we meet in the next couple of weeks, we're going to be talking about strictly taking charge of your heart health, diet and exercise again, screening tests that you may or may not need, different than what we talked about earlier, and understanding the stages of heart disease on how we get there, and if we realize what's happening, how we can prevent a lot of that from happening, from high blood pressure to arteriosclerosis to heart attacks, aortic valve disease, heart failure, all these things that roughly 790,000 Americans suffer a heart attack, and 1 in 7 deaths continue to be caused by heart disease, and it's still the nation's highest killer of individuals so in the United States. So we're going to concentrate almost exclusively on how bad that is and what we can do to be more heart healthy, and what we look for in a facility that can help maintain our heart health. So how's our time, Paul?
Let's see. We've got, well, we're going to start the music in about 1 minute and 15 seconds.
Well, until that time, I want to remind you, like I do after every program, don't forget to stay immunized. That's going to be a huge item on our agendas as we continue to age, and even in pediatrics, make sure that your children and grandchildren are all up to date on their shots. Make sure that you realize that you're at risk the older you get, so if you haven't had your pneumonia shots, there's 2 and there soon will be 3 that you need to get. And the last one is not on the market yet, but it will be shortly. And I was just talking to somebody the other day about if there was going to be another one, and lo and behold, there came the news that there was going to be a 3rd pneumonia vaccine. So at this point, I don't trust the drug companies on whether or not we really need it. When I know more research about it later, I'll share it with you, because it'll be compulsory for hospitals when you're admitted. So I'd like to remind you, we're North Lake Medical Pharmacy with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192, or outside the Bruno Shop Smart on 347 Lakeport Boulevard. Call us there at 263-1328. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday at 10 a.m. for Health Talk right here on AM 1270 and 96.5 FM KXBX Lakeport.